on the advisory for the Health Quality Ontario opioid use disorder quality standards. Probably been doing advisory for about 12 years now across systems level with the Ministry of Health and Health Quality Ontario, Addictions Mental Health Ontario, a whole bunch of different places. So I always disclose that I have personal lived experience with mental health, addiction, and trauma. And I also lost my 25-year-old son to an opioid overdose. So those are the 2 points of reflection that I always bring to the table, as well as the experience of being an advisor. And I'm glad to be here today.
Thanks, Betty Lee.
Hi, my name is Lucie Allard. I am a Francophone, originally from Montreal, but I live in Kitchener-Waterloo. For many years, I've been involved at the community level and moved in the community support level, start being familiar with the LIN, and finally met or joined Health Quality Ontario's Patient, Family, and Public Advisors Council a few years ago. With HQO, I've been involved in quite a few different initiatives, but 2 of the main ones have been the resource development group, which has helped develop a lot of the resources that we have online, very accessible. Another important piece was the Transitions in Care project, now coming to fruition with a standard of care, a quality standard that will be published soon. I'm not too sure. Amy can probably speak to this better than me at this moment. And I know many people online have probably been involved or collaborated on this project. And I'm very happy to be here with you. Thank you.
Thanks, Lucie and Betty Lou. It's such a delight for me to be moderating a discussion with 2 experienced patient and caregiver partners who've contributed a lot to our healthcare system over the years. And I'm really excited to learn from you today. So before we get started, for those of you in the audience, just a little bit about the platform we're using. It's called Zoom, as you know, and I'll walk you through how you can participate. So what you can do is, because of the large number of people who've registered for the webinar, unfortunately we weren't able to use a chat box function, which is what we would do if we had a smaller group, to allow for a free-flowing discussion. But we do have a Q&A box, and this is how it works. You should see at the bottom of your screen a little icon with a Q on it. Click on that, and the question and answer box should pop up. And we have folks in the room here at Health Quality Ontario, our patient partnering team, who will be answering questions throughout the presentation, and then also flagging for us the panelists when there are questions that seem to keep coming up on a common theme. So what you can do is you'll see this. You type into the box, click send to submit your question. And then once a question has been typed in, it will appear for everyone. So everyone will be able to see all the questions that are being asked. We've allowed people to comment as well on the questions that are being asked. So if you like a question, or if that's a question that is important to you, you can kind of like it and upvote it to show your support. And that's helpful to us as moderators as well, so that we know what are the themes that are most interesting to people to discuss. Okay, and we also have polls, and we want to use them actually just to start at the beginning of the webinar to get a sense of who's out there in the audience. So when we launch a poll, it should appear on your screen. You can choose your answer, and once the poll, we'll wait for about a minute to let everybody click on the answer, and then everyone will see the results once they're finished. So let's try it out right now with our first poll. So what is your primary role in the healthcare system? And I know many people will say both, but I'm just going to ask you to pick one for the purpose today, so we have an understanding of the balance between who in the audience today really views themselves as patient, family, caregiver, or resident partners, and who really views themselves as primarily being a professional. Okay, everybody. Fabulous. So here are our results. So we have a lot of healthcare professionals who are attending today, but more patient, family, resident partners. Thank you very much for filling out our first poll. It's great to know that there's that interest on both sides of the partnership table, so to speak. Next poll. Our next poll is about how long, this is for patient partners or family or caregiver resident partners in the audience. How long have you been partnering within the healthcare system? We're interested in this question, I think, just to get a sense of like how much experience is in the virtual room, how many people are here because they're new, how many people are here because they're really experienced and curious to learn from their peers or have something to contribute today. So we'll just wait a few more seconds to allow people to do that. Okay, great. And we're sharing the poll results. So looks like everyone's, the audience is pretty evenly distributed, that some folks are joining us who've been partnering for less than a year. Some people have a couple of years of experience under their belt, and a good deal of the partners in this webinar today have been working at this for 5 or more years. So we hope that you'll be sharing some of your lessons learned and tips and tricks as well. Last poll. We're curious to know, where have people been partnering? What part of the healthcare system have you been working in? This is again for patient and family and resident partners. It could be a local healthcare organization. Many people have worked at the regional or provincial levels with the LHINs or with a provincial organization. Some of you are working nationally, and many of you we know are working across different parts of the healthcare system. Really curious to hear from patient partners in the audience, what part of the healthcare system have you been working in? Because as we know, the kinds of work that you're doing and perhaps the skills that are needed may differ depending on who you're working with. So we'll just wait a few more seconds to let folks fill out the poll. And let's publish it. I don't see any more answers coming in. Amazing. So as you can see, most of the audience members are working in local healthcare organizations, with some working regionally or provincially, and some working across different parts of the healthcare system. Really interesting that we've got that mix today. And interesting too that for many people who are here on the webinar, that their local healthcare organization is the area of focus. Okay. So thank you for sharing a little bit about you, folks in the audience. I think it will be helpful as we get into the discussion around the skills and habits. So right now, I'm going to just walk through a very quick little overview of what's been happening in the Ontario healthcare system in terms of patient and family partnering in the last 10 years. So we're all here today because we're sharing, we have, I think, a shared commitment to improve care. Health Quality Ontario's perspective on this is that patients and caregivers are really core partners to improve the quality of care in the province, and for 2 reasons. One is just our values here as an organization. We really believe that the users of the system should be involved in defining what quality care means, because they're the most affected at the end of the day. They must have a seat at the table and be driving the improvements that are being made. And the other reason that Health Quality Ontario has spent a lot of time trying to work with patients and caregivers and promote patient and caregiver partnerships is evidence. There's a growing body of evidence that engaging effectively really has a positive impact on many different aspects of care, on the patient experience, but also on patient safety, even on patient outcomes, how people heal. And of course, there's growing evidence that patients can have a positive impact at different levels of the healthcare system. So not just in the delivery of direct care services, but in creating programs and services that are more appropriate, and creating policies and guidelines that that really take into account the lived experience and what people want. So those are all the reasons why Health Quality Ontario is interested and invested in supporting patients and caregivers to partner for high quality care. And we've been doing this for 5 years now. We are by no means the first people to be doing this in the province. In Ontario, patient and caregiver and resident partnering has been happening for over almost 2 decades now. And really, there's a lot to celebrate about where we're at. So over the last almost 2 decades, we've had a concerted effort at all different levels of the healthcare system to partner with patients, starting with advisory councils in long-term care, growing in hospitals, now some in primary healthcare as well. And now we see with the evolution and the move towards Ontario Health Teams some really strong requirements to be partnering with patients and other service users in the creation and in the running of Ontario Health Teams. We've seen a lot of attention focused on improving engagement in patient and provider relationships, so creating partnerships really just even in care settings. And we see this, some good examples that I always like to point to are campaigns like Choosing Wisely Canada, which are encouraging patients and their care providers to have better conversations about what tests and treatments may not be needed for them. And the increasing use of tools like TeachBack or decision aids that help, again, patients and their care providers to have good conversations and really put the focus on patients to be able to participate as full partners in their care. And then finally, we have more recently work that's happened at the level of the healthcare system as a whole. So very exciting to see the Patient and Family Advisory Council for the Minister of Health and Long-Term Care get up and running under the incredible leadership of Julie Drury and her group. And it's now been made a permanent body in the legislation that was passed this spring. Cancer Care Ontario and Health Quality Ontario have had patient and caregiver partnering programs for some years now, really trying to embed those perspectives in all the work that they do. LHINs also had the requirement, and Ontario Health, as it goes forward, also has requirements within the legislation that was just passed to really make patient engagement and patient relations a core function of what they do. So really, I think one of the things we wanted to do is, before even kicking off on how to be an effective advisor, is just pause and celebrate the work that you and folks like you have already done to help push the envelope in Ontario. We wouldn't have all of this, I like to call it infrastructure for patient partnering, without all of the work that all of you have done. It's pretty amazing. At the same time, though, we know there's more that we can do to improve. I don't think any of us are ready to kind of pack it up and say, okay, healthcare system is as good as we're going to get. We're all going to go home now. I think we all know there's lots more work and areas for improvement. And that's what this webinar today is all about, what we're here to support. So we thought it would be helpful just to kind of clarify our terms. So patient partners are part of all these different structures. What are they actually doing inside healthcare organizations? As many of you know, what patient and caregiver partners are doing are bringing the needs and experiences of patients and their families to the table. It's really a collaborative relationship. So other folks in the healthcare system, some of you maybe, would consider yourselves to be advocates for certain policies or programs or aspects of care. That's really important work. Patient partnering is a little bit different because you're coming to the table really looking to partner and collaborate with other healthcare organizations. And the result, as we're seeing across Ontario, is that patient partners and caregivers and residents are really helping to shape programs, services, and initiatives, and are improving care. And it's pretty incredible the number of examples that we have across Ontario now. What this looks like really differs depending on what level of the healthcare system you're working at. And so for those of you who have focused mostly on working with a direct care organization, that can be really satisfying work. That's what you tell me, because you're able to see pretty immediately some of the results of the work that you're doing. If you might be working on improving signage in a hospital or a discharge process, or improving the design of a patient stay, or onboarding as you move into a long-term care home. And that's really tangible work where the views of patients and caregivers are essential, really, to making sure that services are meeting the needs of health system users. Patient partnering at the system level does look a little bit different, and it can take a moment to kind of wrap your head around. Well, instead of seeing the more immediate effects on a program or service, patient partners are having effects on the culture of provincial level or regional level organizations. So what that looks like at Health Quality Ontario, for example, is because we've been doing this work for a while, now people won't start a project without asking, what do patients or families or the folks affected by this project, what do they think, and how can we hear and make sure that we understand what they think about this? Right? A few years ago, that wasn't the case. And so that's what I mean as an example of how patient partners can change the culture by changing how other people are thinking about a problem. I do think, so we're going to get to Betty Lou and Lucy as we go. I did want to acknowledge, though, that a very important question that came up as we were starting to put this webinar together, which is we recognize that this is not just all on the shoulders of patient partners to become effective. It's really important that health organizations think about their own role as partners and seek training and guidance on how to do this well. And so I did just want to flag that there are many, many good resources out there, both for patient partners, but especially for health organizations. If you are interested, you can always find them on our website at the URL link below. And we think this is a good website for active patient partners to be aware of as well, both because there are tools and resources there for you, but also because you can learn about what good organizations are doing and maybe share some of these tools and resources that you think are important with your organizational partners. So without further ado, I'm going to turn it over to Betty Lou and Lucy in just a moment to talk about the 6 habits of highly effective advisors. Before we do that, I'm just going to pause and see if there are any questions from the audience so far about anything I've said. Turning to my colleagues in the room. Nope. We're good. We're good. Okay, so we'll jump right in, and please do keep the questions coming as Betty Lou and Lucy dive into the content. Your questions and comments are really important for us to hear, and we're hoping to discuss them. So how did we arrive at the topic of the 6 habits of highly effective advisors? Well, obviously there aren't just 6 things that you need to know. Our advising and partnering to improve healthcare is as much an art form as it is a science. But in our conversations with patient partners who came to us to ask for training, and then talking to patient partners who have done a lot of this work, we identified at least 6 themes that kept coming up about what they felt were the things that allowed them to be effective and influential in their partnering work. And so we're starting with 6. It's by no means the be-all and end-all of the things that you need to do or might want to do as a patient partner, but it's a good place to start. So with that, I'm going to turn it over to Lucy to kick us off on the first one and her reflections.
Thank you, Amy. So my first one is communicate strategically and wisely. And in doing this, I think one of the most important things is always, for every single one of us around the table, is to keep an open mind and to welcome many voices and all the voices. And in this spirit, one of our participants mentioned land acknowledgement. So I am in Kitchener-Waterloo, and I will acknowledge that we are situated on the Haldeman Tract, land promise to the Haudenosaunee, and I'm not sure that I'm pronouncing it correctly, of the 6 nations of the Grand River, and within the traditional territory of the neutral, Anishinaabe, and Haudenosaunee of the 6 nations of the Grand River, and within the traditional territory of the neutral, Anishinaabe, and Haudenosaunee people. So I've repeated myself, and I apologize. But Ani, and thank you, Janet, for reminding us. You know, many of us are very, very passionate about a story, an experience, a journey, and this is why we've taken the role of a patient partner or a family member who becomes a patient partner, or simply a caregiver becoming a patient partner. And in our passion, sometimes we may get ahead of ourselves, and I'm the first one to do that. When I first joined HQO, or Health Quality Ontario's Advisory Council, at times my views and that of others were deferred, and there was one person in particular. We were at opposite end of the spectrum on one particular issue, and that particular issue we could not really influence within the council. That was not the right place. Nevertheless, we would go at it in a debate in the middle of a meeting, and that was not appropriate. appropriate. It was inappropriate. We are not there to debate with all our heart and souls. We are there to carry a message and to participate and collaborate to move issues forward and to ensure voices of our patients are heard, acknowledged with credibility. Our roles are many. Amy touched on many of them before. Some of us are more involved in the day-to-day and the service deliveries in hospital, and others at different levels in the system, whether at the LIN or soon with Ontario Health teams or within an HQO or a ministry. And there are many other roles of advocates and all over the place. And in all those roles, we need to be able to communicate appropriately. The first one and foremost, and that's true for anything we do, to be prepared. To review the material provided to us when there is material provided, and usually there is, or understand the context within which we're going to be progressing. It also often helps to focus on 1 or 2 points before we come in. If we try to do a speech and focus on 10 points, we're losing our audience. When we're within a meeting, the same thing can easily occur. So if we're really focused on a couple of elements that we find are particularly important, it helps us carry the message a little bit better. At times, there are times when we feel that the discussion is going in the direction, we're missing a point, it's not quite there, we'd like to move it forward, the discussion doesn't allow us to, or time doesn't allow us to. It's a good way to find a different moment or a different way of communicating it. So there's a chair, typically, if we are in a committee or meetings. Usually we can approach the chair. Staff may be there as the link or the go-between with the organization. We can approach staff. We may be able to communicate through emails or different forms at different times. And it's important to do that because it helps move the agenda and potentially inform the agenda in the future. I'm going to come back to our best tools. We all have a journey, a story. We all have knowledge we come with, that comes with us. And with that, we can get into storytelling statements that never end. And unfortunately, that only becomes our story. It's really important to ask questions. Asking questions open the door for other views to be included with our own and really leverages the views of many other people in the room, both the expertise of the organizations, the staff, the researchers, and the knowledge and the experiences of the other ones around the table with us. And there are quite a few questions that are listed in the webinar here. But I'll do an example, just one example in our Transitions of Care project. And I say our because many of us were involved and collaborated over a period of time. And it was a highly collaborative project. When it was first presented, Dr. Kieran came and presented to our council at one point. And it was very much the lens of the clinician, the practitioners, the hospitals. And very quickly within the room, all the challenges patients experience, all the delays, one of the areas, one indicator for success, for example, and it continues to be one, but now has all sorts of caveat and challenges addressed. But one indicator for success was that visiting one family's doctor 7 days after a discharge from hospital was a measure of success for the health of the patient. And suddenly there were all these different perspectives. One, not all patients have a family doctor. That's a major barrier. How do we go around that? Not all patients, how do we get to an appointment? Some patients may physically have a great deal of difficulty getting there. They may not have means of traveling there. They don't have, maybe not the money. Children at home cannot leave. A partner at home that they are caring for while they're trying to recover. Difficulties. So all these areas started being addressed over a long period of time. And when I mentioned collaboration, Amy can speak to that. It lasted, 3 years from the moment that, Tara came and presented to us. with many people collaborating. I've seen some of the names of the participants, and I know that some of you were involved quite a bit, very engaged in that whole process. And this is where it makes our voices so important, because it reshapes the discussions and it really makes it a much more compassionate. Many people in the healthcare system are extraordinarily compassionate, highly educated. They want the best for their patients. And if we're able to partner with them and elevate the discussion and take our lens, put our lens on, it's really effective. Thank you.
Strategically. Thanks, Lucy. Sorry, we were on mute. Didn't allow you go. So I just wanted to say that's a wonderful set of questions and kind of reflections on communicating strategically. I have a question for you, but before I ask it, I'm wondering if there are any questions from the floor related to what Lucy has just said.
There's one question from the floor. It's not directly related to a bit related to the theme of communicating wisely, and it's around the theme of continuing to be a patient partner and caregiver as our healthcare system is changing, particularly with regards to Ontario Health Team.
So thanks for that, Stephanie, who's moderating the chat box. That's a fabulous question, and it actually touches on one of the next habits, which is understanding the organizational context. So why don't we just hold on that question, and we'll come to it in a minute. Lucy and Betty Lou.
Yep.
Yeah. Oh, go ahead.
I'm sorry. I could quickly. Interrupting is not necessarily the best, but sometimes it's worthwhile. Sorry. I think there's an important element in communicating wisely and strategically is, as patient partners, we have colleagues, and Betty Lou and I sit on some committees together. I sit on other committees with other members. At the LIN, you will have interacted and built relationship with other patients or staff who can potentially help support or give context, or you can just send out a note to somebody demonstrating your interest and saying how it is that you imagine this, because our perspectives are there. I don't know, I'm not involved in the actual process, I can't say. I don't know what I don't know, but what I do know is that building on those relationships, and Bedelou will continue on this, is certainly important, and we do build our network and we do grow our voices because we help support each other.
Thanks, Lucy, and really what you're saying makes me think that asking questions is actually maybe one of the best tools in a patient partner's toolkit right now as the system is changing, right? Like, you can still ask the question, how is this going to affect patient partners? How can we get involved? You know, or how are you understanding what the needs are in the community? All of the great questions that you've used in specific projects with one organization might still be applicable when you're working across organizations or trying to integrate care. I'm going to move on to Betty Lou now, who's going to talk about moving beyond your own story.
Okay, so Lucy and I are intentionally going to be short. We're going to be about 3 minutes each because we want to leave room for discussion. So I definitely won't cover everything that's applicable, but just enough to start the conversations. So moving beyond your own story is really, really important because, as Lucy mentioned, it's not storytelling when you're doing advisory work. You have a very long-term impact to giving voice. So it's really important to be reflexive, to be reflective, and to really realize that you may be the voice that is the one at the table and being representative as much as you can, but not directly related to be there to share your story. And in that way, you're using your voice very wisely. You need to tie your experience, your lived experience, family experience, and advice into the larger concept, so it actually will be relevant to the advisory table that you're at. So you only actually necessarily need just tiny sound bites of your journey, the pieces that will actually align up what the advisory is looking for, and the direction that you would like to see personally from your perspective. So that means being direct, being succinct, always being professional, of course, recognizing that every voice around that table is important, and every voice around that table really needs to be heard. And you'll pick up your own cues if you're kind of missing the mark on this at first, because watch for body language around the room, because you'll get cues from others if you're going off track or too many details or ranting or too passionate, as we all can be at times. You'll notice the room kind of shutting down a bit. So it's really important to really watch body language there and try and diagnose and figure out what's going on in advisory, because there's a lot of dynamics at play. Trying to broaden your experiences again, once again, to think about, especially if you've done a lot of advisory or engaged at a peer support level, at a community level, a citizen or resident level, and trying to bring in all the people and voices and opinions that you've heard, so you can actually represent others through your voice. Next slide. So it's really important to go from the I to the we, and that's the biggest thing you can always remember, is that it's not about us as much as it actually technically is, but it's not, and it's working in that group dynamic and trying to manage that group dynamic, that you're trying to engage learning together. That I think that one of the biggest things as I close out here is that we are all different. We're all there for different reasons, but we actually need to be a collective voice as, lived experience family, patient, caregivers, residents, citizens. So our messaging is not lost. So if we get involved in our own personal story, our own personal drama at advisory tables, then we're losing our collective impact. So we really have to be respectful and work together. And absolutely, the biggest, most important point to me is that we are never blaming and shaming or finger pointing. That we need to come there to be part of the solution, not to finger point and be divisive. Thank you.
Thanks, Betty Lou. What you're saying makes me think of, well, we had a question about training for professionals as well. And so we have our website and a lot of resources there. But I actually think like the skill you're talking about, which is connecting personal experiences to action for others, is a skill that health professionals also can work on, right? Because when I've been in the room working with patient or caregiver partners and they share a story, sometimes it's hard because you're talking about something very emotional to connect your experience to the issue at hand, but that's something that other patient partners can do for each other as well as health professionals, right? I call it, in my head, my shorthand is it's the connecting the dots skill, right? That's a skill that's not just, and I think the same goes for the previous skill that you talked about, asking questions, right? About how are we engaging with patients on this, is something that health professionals could be asking just as much as patient partners. And in fact, it's probably more powerful when you're allies together in doing some of these skills. Just going to check and see if there are any other questions. No questions so far from the audience. So that's great. We'll move on to the next skill. Back to Lucy.
Yes, to get into the organization's head. When we embark as in patient engagement and we get involved or we start to participate or be a partner with an organization or a larger group, it's a good idea to get a sense of what the organization is all about, what their mission is, what their vision is, who the people are, what is the culture, what context do they progress in. I'll go back to when I joined HQO's Patient Family Advisory Council, because I was quite knowledgeable at a community level, community support sector, the not-for-profit community sector. I had some knowledge of what the health system looked like from being some of the members of the LHIN in Waterloo, Wellington, maybe there, of sitting in the background of the LHIN or interacting on behalf of an organization with the LHIN. But I knew very little about the culture in healthcare and whether there is one or many cultures, because I understand there are a few different cultures as well. And we're surrounded by very smart people. We're surrounded by people with PhDs and multiple masters, all sorts of letters behind their names when they choose to put them behind their names. And it can get very overwhelming. So we have to go in there with the knowledge that we know what we know, and we don't know what we don't know, and get to know the people. People are people, and there are a lot of compassionate individuals out there, and most of the ones who will sit around the table with us want to be change makers. They want to advance. They want to be more compassionate. They want to deliver great health care. They want to have individuals have greater health. So it's really important. So we have to do our homework. Again, we have to prepare. We have to research. We have to be ready. And get a sense of what the expectations of us. What is our role? What context are we working within? What are the expectations of what we should be doing? At what level are we speaking? Are we an advisory level? Are we looking for gaps in the system? Are we both advisory and looking for gaps in the system? At what level of the system are we? Are we in a decision-making body, or are we in a recommending body, or are we in an advisory role? All very different, but getting to know how we fit in there, how we add value, and getting to know the people and building those relationships is really key. The diagram that's accompanying the organizational activities gives a sense of many of the roles that patient partners can have. And as patient partners, we have to understand it's a partnership. So it's a back and forth. It's not just a one-way relationship. It's a relationship where it's also our responsibility to partner with the organization.
Thanks, Lucy. I'm curious, you know, we had that question about Ontario Health Teams. Maybe this is a question for both Betty Lou and Lucy. Like, what is your advice to patient partners who are interested in continuing to work and trying to navigate now, not just one organization and all of the factors that contribute to their decisions, but this new landscape where many organizations are coming together to work together? What advice do you have for other patient partners who are trying to navigate that landscape and understand where they can have an impact?
I think I'll go first here, if you don't mind, Lucy. I think for myself is that, as we always should be doing, is keeping ourselves educated. I know there's not a lot of information coming out, but there is in certain pockets. So it's making sure that you're aware of what's going on and reading the news, like journalistic news and actual facts about it. But I think where I'm really heartened is the fact that the self-assessment forms for the OHT, so that's for anybody, any of the hospitals or anybody that wants to actually form an Ontario Health Team. There's 2 areas that are on engagement in there, which is fascinating because collectively I think there's 6 areas altogether. And one is the patient care and experience. And then they have to qualify how they do all that. And the second part is patient partnership and community engagement. So it actually is built in there that they have to engage, and any of the organizations going together to do that have to prove their patient, family, lived experience, caregiver engagement. So that really encourages me. So I'm not sure technically how it's going to work out, but I think you're going to see more organizations reaching out and ensuring that they have advisories, because they have to do that to even apply to be an Ontario Health Team.
Thanks, Betty Lou.
Yeah, I agree, and I'll go back there. At one point, there was the question about how do you best connect to become to be engaged in that discussion around the Ontario Health Team, and there was another member who was giving a sense of reaching out within the LHIN, getting a sense of who was applying to become a lead on the Ontario Health Team, and the how you want to, and the why you want to be engaged. I think that's an important point, because what do your role, how do you imagine your role to be, and where do you feel your voice would best add value? and have discussions. Do reach out to some people at the LIN and within your community to find out who is taking the lead, or which organizations are going to be critical organizations, or which ones are the ones most relevant to you. And network.
Thank you both. Some great food for thought there. We've got some really fantastic questions coming in now, touching on this point and also on the previous point, Betty Lou, about kind of going beyond your own story and how do you communicate. So we have one question that says, how do you balance problems with blaming and shaming, which picks up on what you were saying before, Betty Lou, with the difficult conversations around issues that impact certain groups? In particular, I'm thinking of health disparities that impact Indigenous people. And I think that's kind of an interesting one, especially thinking about how do you balance those, how do you have those difficult conversations now, even as the health system is evolving, right? And you're having to have those maybe conversations with other partners.
Yeah. I would say for myself, just as a quick soundbite there, is that I never actually minimize my message, no matter where I am, whether it's advocacy tables, public speaking, no matter in peer support roles. I never actually minimize the message that basically the failures of the healthcare system contributed significantly to the death of my son, and also significantly contributed to me being unwell for much longer than I needed to be. So I think what it all comes down to, the short answer to that is respectful. It's how you approach giving your information. So it doesn't mean to at all minimize the impact or the irrevocable damage that's happened to you. It's just the way in human to human interaction, what it comes down to is actually being able to do it in a respectful way, a very powerful and assertive way, but respectful.
Yeah, and in doing that, you leave at the door those preconceptions and those judgment calls. So you leave the judgment behind and focus on issues, potential challenges, potential solutions, and find there are, this is what's really interesting with we say it's a movement right now. There are a lot of voices that are very collaborative right now, and there are partners on all sides, whether at the organizational level, within the system, some who will help enhance the patient's voice, and you will get the support of others. But we have to leave the shaming at the door and step back, so not get into the angry tirades, and that gets us nowhere, and we'll lose all credibility whenever we do that.
And just to add my professional perspective to this, I think that speaks again to the need for healthcare professionals also to be learning about the history of this country, and to kind of sit with some of the with the incredible inequality, colonialism, racism that many people have experienced, and so it's interesting because there is a process of through my own journey of having gone through sitting with shame. Right, like my own shame over that history and my ancestors' role in it, and you kind of need to go through that before you can actually be open, I think, to those conversations. So I think that again just speaks to a need to also invest in having that kind of training and education and process for people working within the healthcare system, so that they can really come and be true partners.
We have a tendency to speak to the ones who speak of the same voice as our own. And it's important that we seek out the other voices, the other perspectives, in order to exchange, in order to understand, and in order to, for anyone to listen, we have to listen as well. And for us to give a strong message, it's good to find voices who are willing to be open-minded, and there are always around a table. There may be one or two people who choose not to be, whereas 10 others may be remaining silent at that time, but will certainly help support, again, solutions, again, looking at challenges, and are willing to do so and are highly compassionate.
Thanks, Lucy. Lots of great questions coming. In the interest of time, let's keep moving on the content, and we'll get to some of your questions after we've had a chance just to cover off a little bit more of the habits that Betty Lou and Lucy wanted to make sure that we discussed today. So I think, Betty Lou, it's your turn now to talk about.
And I just wanted to tell people too that if we don't get to answer all the questions today because of a matter of time, because there's such great questions, I think that we'll find a way that maybe you guys could send the questions to us, and we could find some sort of way of posting or answering them. So I'll go quickly on this one so we can get all of the ones in. Is that keep calm and carry on is hugely important. There's definitely times because of our passion, because of the potential harms that have happened, that we're going to become upset. And the whole thing is exactly to what Amy was speaking to as well, too, is that some of the problems was the advisory team onboarded, trained, and mentored, but more so were the other members who are not lived experience family, patient caregivers. Were they onboarded? Were they trained? Were they mentored? Do they know and do they have an appreciation for patient family advisors, resident caregivers, etc.? And that's a really important piece that it continually keeps getting missed. I think it's not about us or them. It has to be, once again, it's that mutual respect. We're trying to build a movement here. The passion is tied also to triggers. Particularly, I come from the field of mental health and/or addiction. So there's always a lot of triggers that can be set off there. So understanding that we're all looking at influencing change for different reasons. So there's going to be different rationales around the table. So to basically break it down and manage it is basically managing expectations, and also getting fit and skill sets for the people around the table. Safety, trauma-informed approaches are imperative, that we set expectations that all treatment choices must be accepted. We find that a lot in the substance use addiction field. We're all there with different recovery choices, and we have to respect each other's choices. Feedback loops can help. Another person around the table's attitude might be what sets it off. And really not being antagonistic. That's really important for the keep calm and carry on. Thanks.
Thanks, Lucy. There's a question in the Q&A that really touches on this and your comments and experience in mental health. So the question is, how do you balance your own mental health care when local services do not respect your need for care and treat you as a colleague rather than a client, and clients treat you as a worker rather than a peer? So interesting question there about how are you treated and balancing your own really your own mental health and your ability to keep calm and carry on.
Yeah, and I think that comes down to if anybody is going to be doing advisory, and that is that you have got to know your own wellness level. You've got to have your wellness toolkit together. We have to know that with or without mental health issues, that humans get frustrated, and they have a lot of triggers with or without that. So it is a hard negotiation. I'm not one that's going to actually minimize that whatsoever. And I think it is harder for us to get I think we're held to somewhat of a higher expectation, only because advisory and engaging us this way is newer, and like the new people in town are always the ones who have to prove themselves more. So we're actually held to a higher professionalism, so we don't fall into the traps of the labels and the stigmatizing that we have, particularly in the mental health and/or addiction field. So it's kind of like, I don't want to play into anybody's preconceived notions about what people with addictions or in recovery are like, or what people with mental health are like. And that makes me always be profoundly more professional than the next person, just so I can actually not fall into that trap and let people dismiss me. It's a hard negotiation, yes, but I want my voice to be heard.
Thanks, Betty Lou. That ties right in with the next theme that that we had wanted to talk about, and I think it's one that was kind of a surprise to me that this is something that you feel so strongly about, and I know Lucy does as well, and one that I know we have some questions about from the audience, and that is this idea of taking a professional approach to your advisory work. So I'll pass it over to Lucy to kick us off with her thoughts.
Yes, I've been reading the thread of questions and comments as well. You know, of course, practice good meeting etiquette, and this is basic, and be there to discuss and be there to engage the other person. You know, it's not a complaint mechanism, unfortunately. This is not what it is. This is a change maker mechanism. This is what we are there to do: make changes, create partnerships, link our voice to other similar voices and to other voices that may feel disconnected as well. But in order to do that, we need to come prepared. We need to come prepared to participate. There's no other way around it. If there's a meeting, we need to arrive on time. If we say we need to provide feedback, we need to do it when it's during that window, or else it doesn't go away. And for providers to allow that feedback to be reasonable. You know, we have to respect ourselves. We have to respect the people next to us, their space, their point of view, whether we agree or disagree, or be gracious, be patient. And that's often very difficult. And I can say that I'm not always very patient. Because we often, as Betty Lou was saying, we often touch on issues that resonate and that are very sensitive and that trigger strong emotions in us. And that can happen at any time. And it can happen for service providers as well, who have been in certain situations and have a hard time and have worked on moving beyond it. It continues. If we're in meeting situation, if we're within a group, there is a chair, and the chair, we would hope, and is approachable, and we can go and share our concern if we have a concern, as opposed to always voice it in the middle of the room, and it may not carry the weight it should. Be your own advocate. If we need support, and that happens, we often go on teleconferencing right now, and it creates issues at times and challenges for some people, internet challenges, internet that is not consistent. Other types of support, there may be some emotional support that is required at times. Maybe the organization can provide it, maybe they can't, but maybe they should. I don't know. And be clear about those challenges with the staff. Be clear about the scheduling. When staff proposes deadlines, and these deadlines are absolutely ridiculous for volunteers to fall within, state it. Maybe staff has no choice but to, because of the context. That happens, and that's the way it's going to be. But there are times when these can be negotiated a little bit more and adapted so that everybody can better participate and have a more meaningful participation. There was something here talking about professionalism of those sharing lived experiences, creating barrier of engagement within committees, and creating a different power level. Must elevate ourselves in order to have the knowledge contribution to be seen as valuable. And then further down, yes, but what if we can't do that? What if we have barriers of language, of other barriers? And I think there's a responsibility on organizations, and at times with patient partners, in helping facilitate or bridge those challenges, to include the voices and include the perspectives. And this is where, as one advisor, you may not just speak for yourself at one point, and you will ask questions to open up those areas and challenges so that they are explored in a meaningful way. And I could ask Amy, because I know HKO has done a lot of work around that, of how you do reach out to some who may not have a voice or may have more of a difficult time being around a table in a meeting, in a committee, in a group situation, language barriers or otherwise.
Thanks, Lucy. If we had more time, I think that's a topic for a whole other webinar actually that we are contemplating, and if that's something that this audience would like to explore further through this kind of webinar format, please let us know. I'm conscious we only have 5 more minutes. This hour has gone by really quickly, and so I'll turn it over to Betty Lou for the last habit that she wanted to cover, and we'll see if we have time for maybe 1 or 2 more questions after that.
Okay, so I'm going to go quickly through this, but I was reading through all the questions, and I'm hoping that I can address some of that in this. So it's building relationships with others. That's one of the biggest ways to knock down a power imbalance. So I think the questions about the power imbalance and everything too is that I don't ever relinquish my power to anybody at any time. I will not be a victim or be victimized. And I think that that's one of the things is that I will not come into an advisory, with a lower self-esteem or feel like I have to be less than. I actually empower myself by deciding to be professional. That's how I empower myself. And the other piece is building these relationships. They are key. It's to humanize and bond, because every person around that table is a human being. Everybody, find out people's passions, their likes, their cookie stuff. Acknowledge the constructive and meaningful engagement is hard. It's really hard. And once again, it's always trying to be the better person and try and rise above the fray. And I think my small sound bite on that one will be, which I normally wouldn't use here, but I think just with the power imbalance thing, is things like, I'm covered from head to toe in tattoos. So I choose, it's my God-given right to actually go out there and do my storytelling, do my stuff, and not have to cover my tattoos. But if I make that choice, then I won't be heard. So it's my choice to go, okay, I'm going to dress very professionally and cover everything so nobody can dismiss my voice, because they're actually looking at my tattoos and putting me into the small box they've labeled and stigmatized as being an addict. So it's kind of like those little games where it's kind of like, yeah, I guess people could say that I'm relinquishing my power, but no, actually I'm not. I'm empowering myself by making a decision to meet people halfway. And I think that's what the building relationships and being advisors are. And it's that don't let difference be contentious. Nurture respect, remember safety, be part of the solution. And I think those are the really important pieces that I think I want to speak to.
Thank you, Lucy. I think you have addressed some of the questions there, and I think it's really interesting hearing about the choices. I hope that you do not feel the need to cover up your tattoos when you're engaging with us at HQ Ontario. But I appreciate that, it's a strategic calculation that you're making about how do you present yourself in the world. That doesn't really address, that I think there from a professional perspective, there's a whole other set of things that organizations can be doing to be going out into communities, to hear from people where they're at, in spaces that are safe to them. And that is a topic for another webinar. We've reached 1 o'clock. The time has gone by really quickly. Thank you to everyone who has signed on to participate today. It's been a real pleasure to connect with you this way, to hear some of your questions. We'll be sending out a recording of this webinar and answers to your questions, or pointing you to resources that might answer your questions as follow-up. And if this is something that's new for us, but if this is a format of engaging and discussing that you like, please do let us know, and we'll look to see how we can continue on having these kinds of platforms for patient partners to engage with each other, and for health professionals to listen in and learn from their patient partner colleagues. Thanks very much, everyone, and have a great afternoon. Bye.
Bye.
Bye-bye.